South African. In the aftermath of Typhoon Haiyan, half of the facility has been wrecked, and now Gift of the Givers has stepped in. Let's go live to our reporter Dasen, who's with the volunteer team in Palampon in the Philippines, and we do have a delay on this line, so please do bear with us. Dasen, good morning. Can you tell us what are conditions on the ground? It's been a week since you've been there. What's happening on the ground in the Philippines right now?
Good morning. Well, the conditions, particularly at this hospital here, is really bad. As you can see behind me, there are some tents put up outside where there are actually circumcisions that are being done. Surgery and delivery of babies has to be done in a doctor's office on the first floor. The second floor is completely ruined. And that's why the Gift of the Givers is here to actually work on the second floor, just to bring the capacity of the hospital up again. The hospital is severely understaffed, and as you would imagine, it's just a situation that's exacerbated by the fact that more and more people are streaming in. There were quite a few injuries that were sustained as a result of the typhoon. And I must also mention that this hospital serves 4 municipalities around the area that we're in now. So that's about 178,000 people. And there are only 67 medical staff here. So there have been some extra doctors that have been coming in. Some people have been coming in from other countries trying to lend a hand. But as you would imagine, that's also quite a short-term help. So what the Gift of the Givers is trying to do is trying to renovate the hospital, trying to get the capacity up so that there's a more long-term kind of improvement here at the hospital.
Now, Dasen, can you give us some idea of what kind of illnesses are they dealing with? I mean, you spoke about the circumcisions and the deliveries of babies, that's surgery, but what illnesses is the team dealing with there?
The CEO of the hospital was telling us that about 80% of the victims that have come through have sustained injuries when their houses collapsed, or even while rebuilding their houses in the aftermath of the typhoon. So those are some of the cases that they're dealing with. There are also cases of TB. There was a man that actually passed away yesterday while we were here. There's another gentleman that we've just seen now who's also just been almost quarantined in one corner of the hospital. And he's actually suffering from TB. So there are a variety of cases here, and amid all of that, like I mentioned, there are a lot of women that are giving birth. The CEO told us that between the time of the typhoon to now, they've delivered over 40 babies here, and that was their initial projection for the entire month of November, but that's just been over the past, well, less than 2 weeks.
Dasen, would you say that the medical teams there, the supplies that they have, will that be enough to help out with this and in the coming weeks, or do you think that there might be a need to top up those supplies? Will they be running out soon?
Well, the first team that came out with the Gift of the Givers did bring through quite a large supply of medication and other supplies. But there is also a second team that is expected to land in the Philippines, and specifically here at the weekend. So there should be enough to sustain the situation, at least for the next few weeks. And one of the most important needs here is primary healthcare, and that's just been the situation in not just in this area here, but also in the villages. Just to explain, Palampon, the city that we're in at the moment, has about 50 little villages that spread to about 20 k's away from here. And those are some of the villages that we visited over this week. And there you also find a situation where people are just looking for simple things like flu medication and that, but they don't have access to that. So fortunately, the Gift of the Givers team has brought some of that along.
All right, Dasen, very quickly for us, from what you've seen, do you see the death toll sort of reaching a very high number, just based on what you've seen?
I must also mention that Palampon was one of the luckier cities, if I could call it that. Look, there was a lot of destruction here. Houses were wrecked. People lost all of their belongings. But in terms of the death toll itself, it's been very, very low. So the injuries that people have sustained from the typhoon here, unfortunately, in many cases, but not in all, are not life-threatening. So it seems at this point in time the biggest danger that the people face here is not getting access to proper health care, just as a result of how overburdened this medical facility is. In other cities around here, there are community hospitals, but those have been almost completely wrecked. In fact, this hospital, which was reduced to only half its capacity, is actually in a better state than all of those other community hospitals that are around here.
All right, thank you very much. Our reporter Dasen on the ground there in Palampon in the Philippines.
News that moves. eNCA.com.